All right, welcome everyone. Ms. Tanner, has today's school board meeting been properly certified?
Yes, Madam Chair. On July 15, 2020, notice was provided fulfilling all criteria VA Code Chapter 37.
Thank you, Ms. Tanner. I duly call this special meeting to order. First, I would like to thank all our parents, teachers, and stakeholders who have reached out to us to express their concerns regarding the reopening of Norfolk Public Schools. This discussion and the decisions that we make moving forward will be some of the most crucial decisions that we will have to make. I know that our community members are anxious to learn what to expect for the 2020-21 school year. And I want to be clear that our goal is to return to in-person instruction eventually. However, we must be able to ensure a safe working and learning environment for everyone who enters our school buildings. Safety is our priority. At our previous school board business meeting on Wednesday, July 15th, Drs. Pohl, Gibson, and Cataldo presented 4 options to consider for reopening Norfolk Public Schools for the 2020-21 school year. The reopening options included data collected from a parents and guardians online survey that was sent out, and a motion was set forth during our discussion at our previous meeting. Some of our members had requested more information before voting, and so this special meeting was scheduled so that we could have that discussion. But first, what we'll do is we'll have a presentation on the information that was requested from our administration. So I'd like to turn this over to Dr. Birdsong.
Madam Chair, can we do roll call for the?
Oh, I'm sorry. Yes, roll call. Got ahead of myself.
Thank you. Justine?
Here.
Gamson? He's on mute. I called your name, Campson, sorry.
Mute up, here.
Clanton?
Present.
Gabriel?
Here.
Jordan?
Here.
Smith?
Here.
Martin?
Here. Thank you. So Dr. Birdsong, please go ahead.
Good afternoon, Chairwoman Martin, Vice Chairman Jordan, members of the school board, and members of our community. Our agenda this afternoon reflects our continued work and discussion around the reopening options for the 2020-2021 school year. As more and more school divisions across the Commonwealth are beginning to announce their plans for reopening, our parents, guardians, students, staff, and members of our community are anxiously awaiting this decision for Norfolk Public Schools so that families can plan accordingly. Last week, the administration provided the board with 4 options regarding how we might deliver educational services to our almost 30,000 students. These options included option 1, 2 days in-person instruction and 3 days virtual instruction for students in groups, a group A and a group B, with in-person instruction for our most vulnerable students, whom we will refer to as our students of equity and opportunity, which includes, but is not limited to, students with disabilities, students in grades kindergarten through 3, English language learners, and students identified to have learning gaps, as well as those who have other needs outside of academics that will be critical for us to support. Option 2 provides for daily in-person instruction for elementary students divided into 2 groups, a morning and an afternoon group, with 2 days in-person and 3 days virtual instruction for secondary students, and daily in-person instruction for our students or our children of equity and opportunity. Option 3 provides for an in-person instruction for all of our students implemented in a traditional manner. And by that, I mean the model that was implemented prior to the mandated closure of schools. Option 4 provides for virtual instruction for all of our students, which includes an enrollment option for students into the Norfolk Public Schools Virtual Scholars Academy. This afternoon, the administration will provide additional data to the board as requested during last week's meeting as to assist with decision-making regarding what the reopening of schools will look like for our children in the fall. Chief Academic Officer, Dr. James Pohl, Chief Schools Officer, Dr. Linnell T. Gibson, and Chief Information and Instructional Technology Officer, Dr. Michael Cataldo, will provide an overview of pertinent data and will additionally provide requested information related to virtual learning and the school division's COVID-19 health mitigation plan for the reopening. As I shared with the board last week, as educators, we want our students back in school for in-person instruction because it's the most effective way to meaningfully engage the vast majority of our students in the learning process. However, we need to do so when we are confident that conditions are safe for all. The safety of our students, teachers, administrators, and staff must continue to be our #1 priority. Chairwoman Martin, that concludes my remarks. Thank you.
Thank you for that, Dr. Birdsong. So we will go ahead and hand this over to Dr. Pohl for the presentation. Will you be speaking first?
Yes, ma'am. Thank you, Ms. Martin. Thank you, Dr. Birdsong. Good afternoon, Chairwoman Martin, Vice Chair Jordan, Dr. Birdsong, and board members. As Dr. Birdsong said, I'm James Pohl, the Chief Academic Officer, together with Dr. Gibson and Dr. Cataldo. We're here to share some requested data and information for reopening options. As you recall, during last week's board meeting, the presentation included 4 options for the reopening of schools: a blended option of in-person and virtual learning for all students, a blended option for secondary students with an everyday half-day in-person schedule for elementary school students, to fully open using the traditional model, and a fully online model with the NPS Virtual Scholars Academy. As requested last week, tonight we'll be providing information on data that brings to focus our equity and opportunity students, or our students with the highest learning needs, a review of what an online teaching structure will look like, what we will do to address the needs of students of equity and opportunity, how we will ensure students have devices and internet access, as well as the Norfolk Public Schools COVID-19 mitigation health plan. This afternoon, we'll review division level data to help focus on our students of equity and opportunity as the board prepares to give direction on the reopening of schools. As you can see on this slide, we have just under 16% of our students with disabilities and just under 6% who are English language learners. Our top 4 race groups are African American at 57.5%, white at 21.5%, Hispanic at 11.6%, and biracial or multiracial at 6.62%. For further details and for information by school, please refer to the data documents that have been shared on board docs. Looking further into students that may fall into the equity and opportunity category, we will now turn our focus to students who received a grade of incomplete at the end of the last school year. As presented last week, there were 4,703 students who had at least 1 incomplete grade. The total amount of incomplete grades assigned was 12,455, where multiple students may have received multiple incomplete grades. This slide represents the division-wide data on all grades of incomplete. As you can see, the division-wide data, our students with as you can see with the division-wide data, our students with disabilities and our English language learners are nearly identical to the percentage of students that we have in the division. When we look at our top 4 races, white, Hispanic, and biracial or multiracial students are below their division average. However, our African American students are overrepresented in this area by 13.5%. One area where we're unable to pull data is in relation to our low-income families. As you know, we have just over 73% of our students who fall into the low socioeconomic status. Therefore, it's difficult to know if this discrepancy is due to the racial or income disparities based on the data. For more detailed data, please refer to the documents uploaded on board docs. As we move forward with guidance from the board on the reopening plan, there are a few points for consideration. First, over 200 teachers across the division continue to work with all students who received a grade of incomplete at any level last year. Students have been contacted and work is being completed to ensure students receive credit for their courses. Given the extreme circumstances of the mandated school closure, we will work into the fall to support students who are still unable to submit their work to remove their grade of incomplete. As we look to next year, data on each school's equity and opportunity students will be shared with school leaders to ensure plans are in place and followed to assist these students with learning. It is also important to know any online instruction in the fall will be much more robust than what was offered in the spring. As you know, in the spring, across divisions across the nation had to create emergency learning plans, and teachers were thrusted into a totally new environment with little to no expertise. As the board looks to decide on what reopening will look like in the fall for Norfolk, we can properly plan for live online learning with the tools in place as needed. Finally, there will be a focus on the 3 nationally recognized groups, as well as our local equity and opportunity students, to ensure they are not only receiving the instruction they need, they are receiving additional supports to keep them engaged and learning. With a better understanding of who our equity and opportunity students are, let's turn our focus to what our online teaching and learning structure could look like. Starting with some sample schedules, one distinct difference would be daily live interaction with students via Zoom. As you can see in the sample elementary schedule, there are multiple Zoom activities during the day, as well as additional help sessions and times for students to be active. This schedule also incorporates art and music during the week. Students would also have opportunities for independent learning using some of the software provided by the division. As you can see, there will also be times for teachers to work with equity and opportunity students each and every day. Similar to the elementary schedule, there will be daily live lessons through the use of Zoom for our middle school students. In this sample, students will have activities for all core classes each day, either with live instruction or asynchronous activities to be completed prior to the next live class. With transitioning to Canvas as the online classroom for content, teachers will be able to easily assign, monitor, and provide feedback on student work. This schedule also provides additional time for our equity and opportunity students, as well as after-school support for all students. Finally, the high school schedule is set up following the AB or even odd schedule our high schools currently follow. In this sample, you can see students would have direct instruction for each of their classes every day. During each of the small group and independent work sessions, our equity and opportunity students will receive additional assistance, as well as during dedicated time after classes are complete. By following a set time schedule for online learning at each of our levels of school, we believe if the board decides to utilize some form of online instruction due to safety concerns, it will be easier to transition back to a traditional form of school once it's safe to return. In addition, students can be held accountable for being present for learning. Of important note is this sample schedule for schools to allow time for social and emotional support. We will emphasize scheduling small group counseling during non-teaching times, to hosting virtual clubs and organizations after school hours, and accommodating for parent sessions and conference times online to make sure all of our students' needs are met. This includes using an all hands on deck approach to locate any students who are not showing up for the online instruction on a real-time schedule. In order to assist everyone with being held accountable for online learning, we rely on the directive from Dr. Lane, our state superintendent, that there must be new learning for all students as we reopen school. Therefore, everyone in the division is responsible to ensure all students are engaged in learning. This means we will create a method for taking attendance for online session with VDOE guidance that's expected to come out later this week. We will also have best practices for online grading and feedback to students. There will be accountability measures in place to ensure students are engaged and present for online learning. Plans will be developed at each school that will allow a teacher to have assistance with reaching students who are not attending the online sessions or who are not completing and submitting their work. In addition, administrators and other leaders will be observing live lessons. Finally, we will be temporarily redefining roles of specialists and staff who are not assigned students. Building-based specialists, coaches, teaching assistants, school counselors, and the like will be utilized to work with our equity and opportunity students, as well as other students who may become disengaged. With the use of daily schedules and these accountability structures in place, the expectation for a high level of engaging instructional practice will be of particular focus. The division and each school will also be required to have plans in place to assess and meet the needs of our equity and opportunity students. Specifically for our early learners, the division will look to use additional online programs designed to work with early learners. We're developing plans to work with WNPS-TV to have lessons that can be viewed and followed over multiple time slots. There will be scheduled individual calls from teachers and staff to engage students and parents. Small group Zoom meetings will be scheduled, and we will be collaborating with daycare centers for further outreach. For our students with disabilities, there will be additional Zoom time with teachers for extra help, as well as with any collaborative teachers. As needed, live Zoom meetings with each student's IEP case manager will be made available. And most importantly, teachers will incorporate specially designed instructional practices to meet the needs of their students with disabilities. Similarly, English language learners will have additional Zoom time with ESL teachers, and we are looking into software packages to assist with additional needs for our EL learners. Finally, looking to the data we currently have and being prepared to review live data in the fall to seek out and assist with any other student that may fall into the equity and opportunity group, we will incorporate culturally responsive practices into the curriculum to help engage all students. Teachers will respond with additional Zoom meetings during non-direct teaching times. There will be additional connections with school counselors and specialists, as well as scheduled learning time based on formative assessment data. As you can imagine, for all of this to happen online, there needs to be a fair amount of professional development for teachers going into the fall. Plans are in place to finalize and roll out professional development on the two main online teaching tools, Zoom and Canvas, in early August. These sessions will be offered on two levels to accommodate where teachers have current knowledge of using either platform. From the understanding of how to use each tool, they will transition to how the content can be used for teaching in an online atmosphere to include best practices and activities that can be used to assist with engagement. There will also be sessions on meeting the social and emotional need of students, as well as how to incorporate culturally responsive practices into daily instruction. Finally, teachers will receive professional development around how to provide feedback and grades to students, as well as how to track attendance and receive needed supports if students are not showing up for instruction or if they're not submitting work for feedback. In addition to these sessions, the focus for the administrative conference in August will be on a transition to online and blended learning and leading, sessions to support Zoom for leaders, oversight of pooling data from Canvas, effective instructional practice, observing online classes, lessons we learned from the spring, knowing their current data and using it to reach equity and opportunity students, as well as how to host pre-opening events like a virtual open house and meet and greet events that will be offered to all division and school level leaders during the administrative conference. At this time, I'll turn the presentation over to Dr. Cataldo.
Good evening. Thank you, Dr. Pohl. Good evening, Chairwoman Martin, Vice Chair Jordan, Dr. Birdsong, and members of the board. The question has come up regarding if the Chromebooks that have been used and provided to students are able to access the Canvas platform. The answer to this question is yes. The Canvas platform, along with many of the other software programs that students are using and have been using throughout the year, are all web-based. These are accessible with any device that's able to connect to the internet. This is also the same with Zoom. The hotspots that were provided to families work with all Wi-Fi enabled devices, just like our Chromebook computers. This past summer, we collected devices from 5th graders, 8th graders, and seniors. If they were not attending summer school and if they did not have to work on changing an incomplete into a letter grade. At the end of August, we will be following the same format that we followed this past April and May, to have schools distribute computers to new students and hotspots as well to any students that need them starting in the new school, so in their 6th grade and their 9th grade classes. The schools are familiar with this distribution process to ensure social distancing and the safety of parents, guardians, students, and our NPS staff is adhered to. Last week, I had mentioned the advantages for our teachers and students of the capabilities of Canvas to provide a multimedia approach to instruction. Canvas will be aligned to our NPS curriculum and our NPS pacing guides. So when we do go back to blended and or face-to-face instruction, there will be no loss of instruction or no deviation from what we're currently doing. Our teachers have already started Canvas training. Teachers, administrators, and support staff were provided with logins and work with navigating the Canvas platform right towards the last 2 weeks of school. This will continue starting in August 1st. So there are 3 modules that Canvas has provided to us. The first one was done already, and the second and third one will start August 1st. So that'll give teachers the ability to, the information they learned back in June, they'll be able to follow up with that in August. Our professional development, we focus on, will be Canvas training, Zoom training, for all NPS staff working in schools and with students. We want to make sure that everyone is very familiar with that platform and with being able to support student needs. The focus of our curriculum teams will be on how to teach in the online environment, which is very different from a regular face-to-face environment. We're also developing Canvas training modules and videos for parents and students to assist them as well. We will be focusing on helping parents to be able to support their children in this online environment. And I think that is all I have for today. And I think Dr. Pohl or Dr. Gibson.
Yes, thank you, Dr. Cataldo. Good afternoon, School Board Chair Martin, Vice Chair Jordan, Dr. Birdsong, and board members. This afternoon, I will share a draft of the division's COVID-19 mitigation health plan that will outline the steps we will take to reduce the spread of COVID-19. The tenets of the plan include establishing a COVID-19 team. The team will include the superintendent, the division's executive leadership team, the director of transportation, the school nursing supervisor, and a representative from the Norfolk Health Department. The building principal will serve as the contact person at each school facility. We have included contact information for reaching the health department in the plan. Prior to school opening, all staff will complete virtual and/or in-person trainings related to COVID-19 mitigation strategies and procedures. Students and their families will be provided with information pertaining to COVID-19 procedures prior to students reporting to school. The Division of Communications and Community Engagement will disseminate this information to staff and families via email, newsletters, and publications to the divisions and the school's websites. The first days of school will find students receiving an education on preventing the spread of COVID-19. These educational sessions will be provided to students virtually and/or face-to-face. Education will include best practices for hand and respiratory hygiene, use of face cloth masks, staying home when sick, and physical distancing. The need for additional training will be reviewed on an ongoing basis, and retraining will be provided as needed. However, best practices for mitigation will be reviewed quarterly with students. Training in the use of personal protective equipment for non-medical and unlicensed staff will be provided to ensure staff know how to put on and take off protective gear. Nurses and athletic trainers will be trained in COVID-19 recognition and management. They will also be provided with medical equipment that is in alignment with their roles as healthcare professionals. These supplies will include K95 masks, surgical masks, gowns, face shields, gloves, and safety shields. Each school will acquire appropriate supplies to suit the student and staff population prior to opening. To promote behaviors that include the reduction of spreading COVID-19, each school will post signs that promote COVID-19 mitigation practices, hand and respiratory hygiene, use of face masks, and staying home when sick, along with physical distancing. Adequate supplies such as soap, water, paper towels, hand sanitizer, gloves, and masks will be provided for each school. School nurses and athletic training staff will be trained in COVID-19 recognition and management and will follow an established reporting protocol. Practices that promote social distancing for classrooms, lunch settings, assemblies, and athletics are outlined and are aligned to the executive orders and the Center for Disease Control guidance. In order to monitor daily health, the plan includes questions to be used in daily health screenings and steps that will be taken should concerns arise regarding students and staff. Instructions for isolation and quarantining are detailed in the plan, along with the protocol for returning to school. The return to school protocol outlines specifically that documentation from a licensed health professional is required for anyone, student or staff, who is found to be positive. Water and ventilation systems will be inspected by the facilities management team prior to the return of staff and students. Systems will be monitored to ensure they are functioning properly. Any malfunctions will be replaced or repaired before students and staff return. At-risk staff and students who are deemed high risk will receive additional education and will be encouraged to stay home. Students deemed high risk will be encouraged to request virtual instruction. Staff will be encouraged to take appropriate leave and may inquire about developing a plan for alternative work arrangements. Sick leave policies will be adjusted to support staff who are at risk and/or who are sick. Administrators will be required to complete medication administration training. All buildings will have access to a school nurse and trained designees to administer medication in the absence of the school nurse. Mental health services will be provided by the Departments of Student Support, Student Wellness, and School Counseling. When someone presents with symptoms, we will initiate communication and response protocols. These processes will begin with the school nurse, who will take outlined steps and notify the building principal. The building principal will follow the COVID-19 reporting procedures listed in the plan. The Division of Communication and Community Engagement, in collaboration with the impacted school and the Norfolk Health Department, will be responsible for dissemination of information regarding COVID-19 outbreaks and/or positive cases. Notification to staff regarding exposure will be handled by the Office of Student Wellness and the Norfolk Health Department. All parties who share information regarding possible exposure will know and be expected to follow privacy laws to ensure confidentiality. The Department of Student Wellness will provide appropriate medical grade supplies for health staff services. Areas affected by anyone presented with COVID-19 symptoms will be properly sanitized and disinfected. Decisions made regarding the need to reduce in-person classes or close a school building will be made through the division's COVID team, risk management, and the Norfolk Health Department. The school board will be consulted when the possibility of a school closing is being considered. As we prepare to return to school, our health plan will be shared with stakeholders, virtually and in person. We will monitor and retrain throughout the year as needed and ensure that each quarter begins with a refresher for our students. In Norfolk Public Schools, we will do all that we can to be prepared to mitigate the spread of COVID-19 by ensuring our plan and our actions are aligned to the current executive orders and the Center of Disease Control. Thank you for the opportunity to share.
Thank you, Dr. Gibson, and to also Drs. Poole and Cataldo. That was an excellent presentation. I appreciate you pulling this together in such a short notice, and I think you did it very well. So I'd like to open the floor for questions. Are there any questions? Mr. Clanton, and then Ms. Campson, and then Ms. Basine.
Okay, thank you, Chairwoman Martin. Dr. Gibson, I just wanted to get clarity on a statement that you made regarding staff leave. I brought this up at the last meeting that we had regarding COVID-19. So if someone, or Dr. Birdsong, if a staff member is exposed or a staff member internal school building or outside, and they need to do the mandatory quarantine, now I guess it's 10 to 14 days where we look at different guidance. Is that coming out of their bank, or are we, did we come up with some type of proposal policy that's coming out of the last CARES Act? I don't know if it was related to school employees were included in that, but I know that other employees got at least 14 days they had to. So if somebody could bring some clarity for me on that.
Absolutely, Mr. Clanton, and that's a very good question. I will have to share with you that Norfolk Public Schools, we've been very liberal with leave. We have not required, when there's documentation to support that a staff member has been exposed, they've had, close contact and need to be quarantined, or if they have tested positive, that they have not had to use their sick leave. And on August 12th, when we come back to you, Mr. Billups will be sharing more information about our policies moving forward. But we've been very liberal. So we will have something in place for next school year, because we can expect when we bring students and staff back together, we're going to have to be able to deal with this on a daily basis.
Thank you.
You're welcome.
First of all, thank you, Mr. Clanton. That was my first question, because I was concerned about what would happen with teachers who are infected at the school. Would they lose all their sick leave and then be there without pay? So thank you for asking for clarification. My question is, and I saw this from a number of parents as I read through all the letters, all the emails that came in. if say the teacher or a student in a room is infected with COVID, and what happens to the rest? Does everyone go in quarantine for 2 weeks? They need to get checked. Who pays for their test or makes arrangements so that they can get it quickly with a quick return? Sometimes, it's hard to find a place to get a test. I know recently because I had one and it took a while to find some place. Luckily, I got my results back in 2 days, but I know there are people that wait a week, 2 weeks. And will we put something together? Will we have a partnership or something so that we can do rapid testing? And then will everyone in the classroom or other teachers that met together, or what happens? How wide do we go? Do we reach the point that that particular building has to be closed, or what? And I guess that's Dr. Birdsong.
Okay.
This is the reason we rely upon the expertise of medical professionals. We do have an existing partnership with our local health department. And when we are informed of a possible positive case or exposure, we immediately make contact with them so they can start the tracing process. And then those individuals that are involved and need to be quarantined, they are notified by either Dr. Moore or by the Virginia Department of Health. So our teachers and staff, they would know that. Certainly, we would communicate that critical information to parents. It's not a one-size-fits-all approach. We have to approach it on an individual basis. So the situation would have to be reviewed, and based upon the investigation, it would be determined who specifically needed to be quarantined. So I cannot give you a blanket answer because one does not exist. It depends really on evaluated and investigated on a case-by-case basis.
I do understand that we are all learning as we go with this first time in a century situation. I just was kind of wondering how the spread was. And I saw that question come up a lot of times on the emails that came into the board, as I'm sure all of you did. Thank you very much.
You're welcome, Ms.
Chairman Martin. Chairwoman Martin.
Ms. Vaccine?
Yeah, so I'm on. To that point, I would like to at some point, hear more about on our end what we are going to do so that we can manage the contact tracing piece. Should there be an incident, or an instance where a student or a teacher is, symptomatic. And what I mean is, there are other divisions that are looking at, cohorts of students, how students move through the school building. There are lots of things to be considered so that we can minimize the number of contacts a student or a teacher makes in the building. So I think, it would be good to hear more about that in the coming weeks. But to my questions, I have questions specifically about the students, the 4,703 students who had incompletes. Were these largely incompletes? Could you tell me a little more about that? Are they largely incompletes because they didn't have devices and connectivity? Is there more information about why, and how do we ensure that there aren't more students in that group going forward? And how do we make sure that they have the support they need? And it sounds like you're already working toward that end, but if you could describe that group a little more, that would be helpful for me.
So these are the children that for whatever reason, they were not able to complete academic expectations. And as you know, Mrs. Bassine, lots of our children, they come from families of essential workers, and they may not have had the support needed to complete some of their assignments. It could be that for whatever reason, they didn't take advantage of the school's systems technology support with our Chromebooks and MiFi devices. There are a variety of reasons. Certainly our building principals are aware of the specific reasons why our children weren't engaged. I do believe a lot of it had to do with this being kind of a new situation, and people weren't really sure how to respond to it. And I know a family struggled with that.
Mm-hmm.
You know, I have my own children, and I struggled with it, and they were high school kids. So I can imagine, you know, having little kids, it was a difficult time for all. And so we were very sensitive to the needs of our families. We certainly tried to work with our families. Our teachers were in constant communication as much as possible. They did everything within their power to try to reach children. And I think moving forward, now that we know what to expect, we have lots of support staff that were perhaps underutilized during the closure.
Mm-hmm.
We're going to have specific responsibilities for these staff members so that when there's a missing child, and I think Dr. Pohl spoke to this a little bit, we're going to have every resource possible available to make sure we are able to find children, to determine why they are not engaged, and do everything that we can within our power to help them to engage in the learning process.
Okay. And then my next questions are around the devices and access specifically. So it sounds like some students returned their Chromebooks and MiFi spots. And I think if I heard correctly, was it just the fifth graders and the eighth graders that returned there? Okay.
Children that were transitioning from elementary school to middle school, from middle school to high school, or if they knew they were going to another school the following year.
Okay, so everyone else who received a Chromebook and a connection still has theirs?
Yes.
Yes?
They do.
So will there be a follow-up technology survey of all of our families to make sure that we are hitting, getting every child and family what they need?
There has to be.
Yeah.
There has to be. Individual schools will be reaching out to their families.
Okay.
We certainly, for example, if we are online starting in the fall, we would have to implement the same process that we did during the closure, to have kind of a drive-through or a drive-by distribution process whereby families could come in and pick up the Chromebooks and the MiFi devices.
Okay,
so
great.
Certainly we would have to do that.
Okay, great. And is there discussion happening about providing every student with a Chromebook and a device so that all of our students are working off of the same technology?
Absolutely.
Okay, and is that something that is being considered for the start of this school year, or
Yes, because we placed a large order, and I'm going to let Dr. Cataldo speak more to this. Whenever schools were closed, mandated to be closed, we started with the ordering process. And so as I've shared with the board, we plan to utilize stimulus funding to support some of those purchases. So Dr. Cataldo, you want to add anything to that?
Yes, definitely. So we want to make sure that all of our students have access, again, to the same technology and all the same resources. So we definitely want to ensure the students do have all those the newer devices that we have just purchased. So I think that order is coming in, I think in the next week or two, but we anticipate getting all those to students, because we realized too from the closure earlier that some students or families said, oh, I have a laptop or I have a device at home, I don't need anything. But then we found too that some of them had difficulty getting on Zoom and putting on these programs. So what we started doing is saying, let us give you the device. We have all of our programs on there. We can actually remotely fix and diagnose issues with their computers. It doesn't have to be in front of us. We can send information as long as they're connected to the internet. So we do have control over those devices as far as updating them and making sure that they have all the working processes. And also we were telling families that if there is an issue with your computer, contact the principal. The principal does help desk. And so we're able to quickly diagnose an issue. And we're also going to be telling our parents that if you're having software issues or connectivity, as far as not necessarily the hardware, but maybe the program, I can't log into to Canvas today, or I'm having problems with Zoom, that we have ITRTs in all the buildings, and they have been trained and been training teachers on this. So they'll be able to provide that support. So we're going to have a lot of support for our parents and our students, and similar devices with full capabilities for everyone.
Okay, great, thanks. And I have one last question related to the mitigation strategies in place or being worked through. Can you share a little more about the status of those strategies and where we are currently, and where you expect us to be by the start of the school year in terms of having those measures in place in our school buildings?
And I'm going to have Dr. Gibson address some of that, but we have to be prepared day one. There's just no ifs, ands, or buts about it.
Right.
We've got to be prepared. In fact, along with our professional development plan, there's a lot of training that we need to conduct during the summer prior to the start of school, specifically related to this plan. So we certainly anticipate being able to roll out a very comprehensive plan around the training for our teachers and staff, and are going to be ready to implement during the summer so that we're ready for the first day of school.
Okay, and I should be clear. So in addition to that, I also mean to accept students in the school building. So those, whatever strategy, whatever mechanisms we need to have in place, whether it's seating, assessing our capacity in our buildings, assessing all the things that you already addressed, in terms of air quality, or I think that was one of my questions, but all of the other things that you talked about, will we, if we were to do some level of in-person learning September 8th, will we be in a position to do that carefully and safely?
I'll respond. At this point, we have ordered PPE equipment for staff and students. We've ordered tape for floors to mark social distancing. We have just begun to send out signage for principals to post in building just to deal with the visits they're getting now. But we will be planning to send out signage so that all schools will be able to print and post the needed signs as stipulated in the plan. Once the order comes in for the equipment and the supplies, along with the plexiglass that we've ordered for main office areas, we will be moving those things into the school so that we can do installations, we can set up the clinics and set up areas so that we can service the needs of the faculty and the students. We are at the very beginning stages. We're waiting for materials and supplies to come in. We are collecting signs from the CDC and Virginia.gov as well as Norfolk.gov. So probably within the next 2 weeks, you should begin to see these things coming to life in the schools. And we will be working with our principals via Zoom so that we can help prepare to make sure things are standardized and they meet the standards that are stipulated in the plan.
Okay, all right, thank you.
You're welcome.
Thank you, Chair Martin. Dr. Birdsong and staff, thank you very much for the presentation. Extremely thorough and a lot of information, especially for parents and our stakeholders. I would like to commend and reiterate how I've heard multiple times that you said that you were in direct connection with our partners at the Public Health Department. In meetings that I have been in, and I know that meetings that you all have been in, from the top down, the message is pretty similar. The localities have the autonomy to make this decision, and you should be in contact with your public health department about safety measures. And so thank you for sharing with all of us how engaged you are with them and how they are your partners every step of the way. I'd like to go back to the presentation, and I just wanted to make sure that I understood, and maybe you can provide some clarity about, I heard something about quarterly check-ins, and I wanted to understand a little bit more about what that meant. So some parents and families would like to know, at what point in time is the division going to reconsider in-person student instruction? Is there something that we can anticipate? And I wasn't sure if the topic of the quarterly updates were an internal decision that you all were looking at different data points and measures, or if those were things that you were looking to share with the public going out. So I just wanted to clarify that point if you could. Thank you.
Okay, I need to make sure I understand what specifically you're asking about. I know Dr. Gibson made mention of a quarterly check-in with the students to make sure that quarterly we were engaging them in additional information about COVID-19, how to keep themselves safe, how, to engage in social distancing and hand washing and hygiene and things of that nature. I don't think you're referring to that, though.
Okay, then that is different. So
Yeah.
my question then would be is what has the administration thought about as far as working with public health and determining check-ins with our stakeholders about when the appropriate time is to return to school? What are y'all thinking about with regards to that?
So at the end of the day, again, we are not the medical experts, so we depend heavily upon their expertise in this area. We are constantly looking at our health data, our local health data. As I shared last week, there were some concerns locally about our spikes and where we are in terms of testing, individuals testing positive within our area, within Norfolk. And so certainly as a state superintendent Lane has said time and time again, you must be in collaboration with your local health department to, talk about decisions, and certainly with the school board about, assessing the health of your locality. And so I don't think there's going to be quarterly check-ins. This is something that we're almost doing on a daily basis because there's always, this virus is a novel one and it's changing, evolving every single day. So we are committed to this continued partnership with our local health department, our colleagues in that area. And so we're in constant communication, talking about the data, thinking about what things will look like. And of course, today, we don't know what things will look like in 3 weeks from now. Mm-hmm. But this is something that we monitor. It's on an ongoing basis. This is every day, all day for us.
Thank you.
But again, our first priority is the safety of our children, our staff, and our teachers.
Thank you.
Ms. Basine, and then Ms. Smith, and then Mr. Jordan, and then I'd like to wrap up this questioning so that we can get on to the next part of our meeting. So go ahead, Ms. Basine.
Yeah, I wanted to piggyback off of what we just talked about. So more directly, has the Norfolk Department of Public Health okayed, the reopening of our school district? Or have they reviewed our options and
they, what they won't do, because they know that's a school board decision, they can give us information and data so that we can make an informed decision. But you won't hear Dr. Lindsay say, I advise you to or not to. She'll say, these are the local conditions, these are statewide conditions, these are the things that we are concerned about. And so it wouldn't be a direct response from her or her staff about, yes, please move forward with reopening. That won't ever happen.
Yeah. And I asked that specifically because I did notice in other localities, because this is such a difficult decision, that health officials in those localities have weighed in. Of course, it's the school board's responsibility. But I have seen that health officials have at least provided their recommendations or support for whatever the division decides to do. So anyway, thank you.
You're welcome.
Ms. Smith?
Thank you. Dr. Birdsong, the incompletes that occurred with the minority groups or African-American groups is very alarming.
Yes,
and you did mention that there are measures in place to try to help them complete those incompletes that occurred from this school year. So going forward with the 2021 school year, what type of updates can we expect that keeps us abreast of their progress this time around?
Sure. So, we can continue to review data. So at our board meetings, we can certainly do that. But one thing that I'd like us to be mindful of is as we look at that metric, you're right, it is extremely disturbing. However, and I think Dr. Pohl mentioned this in his part of the presentation, we have about 74% of our children, Ms. Smith, that qualify for free or reduced lunch. So I would say that it may be more to do with families who are, maybe financially struggling and have other situations that would prevent our children from being engaged at the level that we would want them to. And so that's why I believe that we have to be more intentional about looking at every individual child, what their circumstance is, having every teacher account for their children every day, which is why we put the accountability measures in place, having teachers take attendance, who's missing. If you're missing from class session, okay, then we're going to have, these individuals to do what is needed to try to find the child and determine why they haven't been engaged. Is it because there's a sick family member? Is it because for whatever reason their parent was not able to pick up a device? We need to be more intentional about that. And I think if we start looking at individual children instead of children in groups, I think we can definitely decrease those incompletes. I feel very confident about that.
Okay, thank you.
You're welcome.
Mr. Jordan.
Yeah. First, Dr. Birdsong, I'd like to thank you and your team for the presentation. I thought the data, at least for me, was very helpful. And from last week's presentation and this week's presentation, really gave me a better context for decision making. I just have I think a few questions. One kind of starting with where we just left. You had mentioned earlier about essential workers, and you were just describing some of the challenges that some families may be having during the pandemic, which then can have impact on students being engaged with online learning. Can you all describe in your model how much reliance are you looking to an adult being in the home to support children, especially the younger children, as part of the online teaching and learning model? I mean, how much reliance do you see needs to come from the home in order to support the model and the scheduling that you propose?
So, and I'm happy to allow Dr. Pohl to add to the comments that I'd like to make in that regard. So, Mr. Jordan, again, moving forward, we have a more structured process. So when we had the mandated closure last year, there were Zoom sessions, but they weren't consistent. And if our children now have schedules, our teachers have schedules. So there will be, specific times for children to engage in certain activities, whether it be science instruction or PE or music or what have you. There will be schedules with daily interactions with teachers. And I think that will make a big difference. If a child knows that they can look forward to seeing their teacher the next day, I think that'll make a big difference. And I think that will add to the level of support that the children need with completing their assignments, which means there would be less reliance on an adult to have to guide them through every single activity, because the teacher would be able to be there to provide that direct instruction.
I would just add, Dr. Birdsong. I would just add, I think, as we all know, age level and learning, it is dependent upon that. It's just like, we wouldn't leave a 5-year-old by themselves if we go to the store necessarily. We might need to help them log in, but I think within a couple days and cycles, they learn routine, they learn pattern. And with the daily instruction, it may mean a parent might need to help them log into Zoom the first time or show them where the link is the first time. But there will be more independence with the child and the device because it's live and there's accountability on both ends at that point. So we're hopeful with this plan that even if certain ages children might need help getting on that device to start with, the parent's not tied to the work like they were if it was a handout or a worksheet or something that didn't have the live interaction with the teacher. Even going out to small group instruction with our younger children to make sure that we're reaching them and able to reach their level of need.
And I know you can't be too specific, but just kind of generally speaking, as you just mentioned, we wouldn't leave a 5-year-old alone in the grocery store. Can you kind of get some sense of, if you were maybe what we would encourage families to look at to try to have available in order to maximize student success in the online environment? Are there some best practices or some recommendations we would ask families to consider to ensure their student success?
So,
I'm sorry, go ahead, Dr. Pohl. I was just going to mention the training that we discussed earlier for our parents, Mr. Jordan. We're going to have training sessions for our parents so that they are aware of, the best practices related to virtual learning, utilizing the various technology tools so that we can set them up for success so that their children can be successful. So, Dr. Pohl, I'm sorry.
We're right on the same lines because we are working on parent PD, especially for the younger level, for our equity and opportunity students to make sure their parents have a good understanding of what we're asking. We're trying to put every support possible in place so our students are successful. And then also every support possible in place. If the board decides that we start virtually, when we come back, it's not an understanding of, well, we already learned that, so we're moving on. It's okay, how do we recapture all this still as we move forward?
Okay. Next question is, if health and safety conditions allowed for it, and we had sufficient numbers of teachers willing to volunteer to do some in-person instruction, based upon where we are right now in terms of equipment, orders, all the things that Dr. Gibson's talked about, if we were to start September 8th with a component of in-person instruction, how many schools do you think we would be able to have ready on that day if we offered some limited in-person instruction?
So my response to that would be that we would certainly be prepared. If the board directs us to move in a direction whereby we need to provide the in-person instruction, we're going to make it happen. But again, I would also caution the board too about looking at the local health data and making this more of a decision around health and not education. So if we believe that some groups of children, if we believe that the health conditions, the conditions of our locality would not be conducive to children reporting to school, I would just caution you about deciding which groups it would be more safe to come to school and get the in-person instruction versus another group of children.
Oh yeah, no, I premised my question with if we had all the safety and health okay from the professionals. And then my last question is just to get a clarity again on the device issue. So are we saying that come September 8th, Norfolk Public Schools will provide to each student and staff person a device and a requisite broadband device, connectivity device, to allow them to participate in the virtual online learning platform per the specs that Virtual Virginia has established? We are going to provide each and every student and every staff person a device by September 8th.
And again, to go back to and Dr. Cataldo, feel free to jump in there. If there's a need for the device, we will absolutely ensure that every child that needs a device gets a device. But again, some families will not want a device because they believe that their child's device is appropriate and it can manage, the programs that we will be implementing in the fall, the online programs if needed.
Yeah, I understand that a parent may choose not to use it, but from our inventory, if it's 35,000, we'll have 35,000 available and ready to go September 8th, and, whether that includes what we already have or not. Is that correct?
According to what Dr. Cataldo said just a few minutes ago, he's expecting an order in a week. So, Dr. C, that's what I heard you say. So
That's
I'm
exactly
excited
right.
about them being here in a week. I wasn't aware of that. So that's great news.
Yeah, so we definitely, every one of our students, if we were to take a look at every student and every device, we have more devices than we have students currently in NPS. So we're not going to be, keeping some that no one can use. They're going to be all out there ready for everyone to use. We just purchased a large number of devices, and they'll be coming in very soon, and they will be part of that. So we have more devices than we have students in this division.
Thank you.
Okay. All right. Well, Ms. Campson, go ahead. One more question.
Thank you. I have one last quick question. Back to a little bit of what Dr. Gabriel was saying. There's been a lot of questioning by parents about time periods. And of course, we know that with what's going on, it changes rapidly by the day. But I was wondering, so if we're this board, and we haven't voted yet, I know we're getting ready to move to that now. If the board votes to go all virtual for the opening in September, are we able to say to parents, and I know Dr. Birdsong will be looking at every little teeny tiny piece of data every single second, because that's all she does. She just stays at work all day. But well, pretty much. She's so conscientious. But would we be able to say to the parents to add on to this, we're going to do this, we're going virtual if that's what the board decides and votes on, and we're going to be reevaluating and looking at it as the quarter ends. And if we continue to stay on virtual, we're going to be looking at it again and monitoring it at the end of second quarter, so that as soon as the conditions are ready, we can start phasing in with maybe a hybrid program or something, so that it's more definite. Like and really, our PTA president, who I'm sure called everyone, Sharice Newsom, was the thing that she's hearing a lot from the parents too. Just tell us a time period. If you're saying it's going to last at least a quarter, then let me know that so I can make a preparation for the first 2 months of school. And then it'll be considered again. And I'll hear before the end of that first quarter if another quarter is being tacked on. Is there a way that we can look at that and consider that for the parents that are trying to plan their lives and daycare and those kind of things?
Yes, I would definitely recommend to the board, whatever decision, if you decide to vote this evening on an option, we need to have a time frame around that.
Right.
And again, we need to, so families can prepare, but also we need to be flexible too, because as you stated, the data changes every day.
It sure does.
Monitoring on a daily basis. And if for whatever reason, we're online 100% for the first 9 weeks, certainly we wouldn't wait until the end of the 9-week period to monitor things. We would be monitoring throughout the 9-week period and would make adjustments accordingly. And even if that meant that kids ended up back in school, either on a hybrid model or whatever the model might be, but we would continue to need to do that because, again, this is a novel virus. Things can change. And so, again, we have to be flexible and be prepared to adjust as needed based on our local conditions.
Thank you. That's, I think, a question that a lot of parents had. So I appreciate the answer.
Thank you for asking that question. I think that was worth waiting for. So thank you to Dr. Birdsong, Dr. Pohl, Dr. Gibson, and Dr. Cataldo for that wonderful presentation. and entertaining our questions. I think these were questions were, I think we covered a lot of what we've heard from our community, their concerns, and so I really appreciate taking the time to do this again. But moving forward, we do have a motion that we need to discuss. Yeah, pull it up. It is on board docs for those who are watching. Okay, the motion that we have that was stated at our July 15th business meeting and then tabled for this special session is, I'll read it. I move that the board, it was moved by Dr. Noel Gabriel and seconded by Mr. Carlos Clanton. And it reads as follows. I move that the board directs the superintendent and administration to plan for 100% virtual learning to begin the 2020-2021 school year, to give added consideration to the academic priority groups, and in parentheses it says K through 3, special ed, and English language learners throughout the virtual learning process, and for when it has been deemed safe to return to in-person instruction. So what I'd like to do is open it up for discussion. Let me get back to everyone. Yes, Mr. Clanton.
Okay, thank you. I just wanted to go back to what Dr. Birdsong was mentioning about the time frame, and I'm in agreement with that. And I think that the motion that we had from the last meeting states that we would do 100% virtual learning for the 2020-21 school year. But I do think that our parents and the general community need to have some type of time frame around that. And so I wanted to direct the question back to Dr. Birdsong. You mentioned 9 weeks, the first 9 weeks. Is that a good starting point that you would make a recommendation, or is there something else that you would recommend?
That's a wonderful question. That's a great question, Mr. Clinton. I wouldn't recommend anything beyond 9 weeks, and I don't think I would recommend anything less than 9 weeks. Whatever decision you make, we need to, certainly if the conditions change, we need to be flexible and be able to change it. But for our parents, they deserve to have some type of stability and know in what direction we're going in, at least for a quarter.
Okay.
So then is 9 weeks considered a quarter? I just want to make sure that we're all clear on what that means.
Yes.
Okay.
Ms. Smith and then Ms. Basine.
Dr. Birdsong, to what extent are we prepared to offer in-school instructions for the nationally recognized groups during the first semester on an optional basis?
So again, as I stated previously, certainly, and whatever the direction the board decides to go, the administration will plan and prepare accordingly. But again, I would stress, for the board to consider if the board believes that it's not safe for children to return to the buildings, just consider which children you believe it to be safe to return. So that's my response, Ms. Smith. I hope that answers your question. We will be prepared for whatever option the board decides to go in.
Thank you.
Ms. Basine?
Yeah, I mean, I certainly agree that we have to put parameters on our virtual learning. The first quarter ends on November 2nd, and second quarter starts November 4th.
Correct.
So, right. And
that's correct.
Yeah. But to Ms. Smith's question, I think that we know that this pandemic has caused great social and economic inequities for our students, which also presents a level of safety or a lack thereof. And if there is a way to, and the VDOE and the VDH guidance does allow us and does recommend that we look at the groups of students in greatest need to consider bringing them back into the learning environment. I mean, that is their recommendation. And I know other health groups have also put that recommendation in place. So if there is a way to bring within that first quarter, if once we have all the safety measures in place and we have assessed our teachers in terms of desire to work in the school building, I would like for us to consider bringing back, and very carefully bringing back students that most, all of our students benefit from being in the classroom, but those groups of students that we know benefit the greatest. And so I would like for there to be some consideration and plan for phasing in groups of students into the school building.
Is that a question, or is that?
I'm just putting that out to the board because ultimately, the board, can make the decision, but we also have guidance that's been provided to us from both VDH and VDOE. So, I would like that for us to consider that.
Okay, thank you. Mr. Jordan, Dr. Gabriel, and then Ms. Campson, and then Mr. Clinton.
You're on mute.
Saw it. Sorry about that. Since I think we're in discussion, what I would like the board to consider is having the administration prepare for a limited in-person instruction option available to students, equity and opportunity students, or some subset of that in September. I think that the health data will determine whether or not we would utilize that option or not. But I think we should be prepared. As I haven't heard anyone say right now that we've been told that the current health conditions state that that we cannot offer some in-person instruction. So when we look at the data that we received related to the students who have the incompletes, when we consider the engagement data that we heard last week, when we consider the research that's been out there around some students benefiting from in-person instruction, and then as we consider the essential workers and the other families that we talked about in terms of needing some parent support, I like to see us go into the new year with the idea that not only would the 100% online be available to everyone, but that we would also have a in-person option that students and families could opt into based upon criteria that we establish, and that likewise teachers could opt into. I think if we don't prepare for that on day one, then we will always kind of find ourselves in a challenge of trying to figure out what the right mix is, even if we start the phasing after the first 9 weeks. So I'm just recommending to the board that we, as part of this, we just ask the administration to prepare for some initial cohort to be able to receive some in-person instruction on day one. And ultimately the health data and the other data that Dr. Birdsong has talked about will let us know if we're able to utilize it, as the health data will always tell us whether or not we're able to utilize in-person instruction. I just think it's better for us and for everybody else involved to know that that's an option that will be available, all other things, safety and other measures being available.
Mr. Jordan, if you look back at some of the reopening options from last week's presentation, It actually notes that they were planning to have a daily face-to-face instruction for most vulnerable students. That's actually listed underneath. So to me, that sounds like, daily. So that sounds like something that's already being considered. Is that?
Yeah, I agree. I just wanted to be clear since we've waited a week and since we're having this discussion, I'm just recommending that in our framing that we provide to the administration that we be clear about it.
Okay, well, Dr. Gabriel, did you want to go ahead?
Sure, I can. And since we are discussing the motion that's on the floor right now, I would like to agree with you, Chair Martin. All the emails and phone calls that we've received from the staff and the students and stakeholders is greatly appreciated. And I would say that, as I mentioned before, safety of every life, the 30,000 students that we have, the 5,000 employees that we employ, of which is the largest in the city, their safety is paramount. And I think it is very important with the data that we have right now that we give the administration very clear direction on what the opening of school is going to look like so that they can prepare. And I'm amazed at how much they have already prepared and have planned. I'm amazed, but I'm not surprised because we have Dr. Birdsong as our superintendent. So what I would like to do is ask Mr. Clinton, the parliamentarian, I have no problem accepting an amendment to the motion so that we can clearly define virtual learning of the first quarter with reevaluation. But I'm going to defer to Mr. Clinton if he wouldn't mind offering a suggestion, just because we have a motion on the floor, and a motion is to take action. And so I would just encourage us to move in that direction. And I respect and I wholeheartedly agree that for our very vulnerable students, the in-person interaction is very important. However, I think that with the strategies that the staff have put in place, I think that the safety portion of it makes me feel a lot more at ease with what we can do for these children ahead. So, Mr. Clayton, amendment, would this require an amendment to the motion?
Yeah, so we're not in the same meeting as we were last time. So any amendments to this would require, Ms. Martin, an actual motion to amend by a board member and a second.
Yeah, and if I may, just to be clear, I knew we were in discussion, and I was just sharing with the board some input as others have had the opportunity to do so. I just want to say again, I agree with the safety. I haven't received any data yet that says that we could not prepare for in-person instruction on a limited basis come September. If others have that data, I think it's important for that data to be shared. I also like to say that, yes, I have said repeatedly that safety and security is paramount. But it's also the case that we have data that is showing us that students, we want everybody to be safe and secure so that we can provide teaching and learning. And so if the conditions allow for it, and if our data is showing us that it's needed, what I was just simply putting out for the board for consideration, and I'll offer a motion if need be, or whenever it's required. I just wanted to share my perspective that I think, based upon the data, as we are talking about this as a board, that we consider being clear in our framing to just have the administration prepare for some limited in-person action in September when school starts. That's all. Thank you.
I know Ms. Campson, and I don't want to overshadow you, Ms. Campson, but I would just ask that as Mr. Jordan, based on what he's saying, that if he could frame that as a separate motion from what we have on consideration.
I'm willing to do that, but I thought at this point, Ms. Mark was trying to make sure everybody had an opportunity for this.
No, I'm just saying.
At the appropriate time, I'd be more than happy to do that.
Thank you. Okay, Ms. Campson, you're up.
Yay. I just want to say, as the person who offered the friendly amendment to bring in our high academic priority kids, that that it's divided into two sections. If you look at it, which says the first section says to offer added consideration throughout the virtual learning process first. And then the second half says, and when it becomes safe, do person to person when it's deemed safe. So I think it somehow got mashed together. And what I meant for the first half, and it's good to get this clarified since it's now already incorporated into the motion, is you could do consideration even with virtual. I mean, I'm the one that's pushing face-to-face for the little kids because that's developmental reading and it's so important. However, you can do it like you do it in the classroom. You set up intervention groups. And we have specialists, reading specialists and math specialists in our buildings who could lead, and some interventionists too, who could lead special groups that they pull together 2, 3, 4 times a week for a half an hour to work on particular skills that the teacher said that they need to have. So that to me was what I was thinking when I was saying added consideration for the first half, that during, if the board votes 100% virtual, that there would also within that virtual model be an added support the way we would do in a classroom. You're doing face-to-face there and you still have children that are struggling. What could they get extra? And you could have specialists taking the most needy of those students from the 3 groups and pulling together little intervention lessons that they have in addition to what they have with their own classroom teacher during virtual, and then go into all the things like what Mr. Jordan has said. But we have to be very careful, I feel, when we go to decide who's going to get a little bit of extra face-to-face to begin with. We don't want to risk having any of our priority kids turn into canaries. Just saying.
Exactly. Mr. Clinton and then Ms. Basine.
All right. Thank you, Chairwoman Martin. And I appreciate all the deliberation on this particular item here and the thoughts and comments that my colleagues have shared. I agree with Mr. Jordan in the respect that I think that we have to continue the planning. We need to send clear direction to the administration to be able to have those plans for when we return to what the new normal will look like and how do we get kids back into the classroom. However, I think that we need to make a decision today, and that's where we tabled and placed this item here. And so with that, based on the original question that I asked Dr. Birdsong regarding a timeframe, letting our parents know what a first kind of trigger where we're going to be assessing this, I'd like to make an amendment to the motion that we have here to bring clarity around that. And I want to do that on line 2 after the word to begin the, and add first quarter, parentheses, 9 weeks, close parentheses, of the 2020-2021 school year. So it will read, I move that the board directs the superintendent and administration to plan for 100% virtual learning to begin the first quarter of the parentheses, 9 weeks, close parentheses, of the 2020-21 school year, to give added consideration to the academic priority groups, K3, special ed, and ELL, throughout the virtual learning process and for when it has been deemed safe to return to in-person instruction. This way, by doing that, we know that the first 9 weeks, the board, when that particular time frame, should come back, reassess based on what the administration is telling us, health-wise and so forth. And if we need to continue, then we are sending a clear direction from the board, working with the administration to the community and our parents, that we're going to continue this process on, or if there's some change, we can do that within that time frame.
So I second that amendment.
Any comments? Okay. Ms. Tanner, please call the question.
I have a point of clarity, if I may. So we're voting on the amendment? We're voting on, can you just explain to me exactly what we're voting on?
We're voting on the amendment, Mr. Jordan, the one that I just gave. So adding the words first quarter, parentheses, 9 weeks, close parentheses. So that's what I'm adding to the amendment.
May I ask you a question about that for a point of clarity? So when I'm sorry?
Go ahead, Mr. Jordan.
When you add the 9 weeks and we keep the language that says, and for when it has been deemed safe to return to in-person instruction, if I understand what you're proposing, Mr. Clanton, is we're clear about 9 weeks.
Mm-hmm.
that we would do, your motion would be all virtual, all online, I'm gonna say, all online instruction for 9 weeks. And then can you explain how for when it has been deemed safe to return to in-person instruction, how that plays into the piece of it?
So I think that goes into within that 9-week period. And I think Dr. Birdsong, you gave us some dates when the quarter ends and when it starts, that within that period, whenever the board's meeting, that whatever information is given to us, I mean, like we said, this is a novel virus, every day it's changing, that by that period of time, if it's saying that that the positivity rate's going down, we don't have community spread, it looks like, we can go into a different direction. Then based on what you were saying earlier about having these smaller cohort groups, we could move in that. But I think that we just got to have a clear cutoff point, and rather than saying for the entire year, that the board is forced to work with the administration to say, we're going to look at this and make a reassessment based on where we're going. Can we move in with those other options, or do we stay with virtual for the remainder of the year and put a new time frame on it?
Right, but aren't you just saying that we would do virtual learning for 9 weeks, period? And then
I think we're gonna start off with virtual learning for 9 weeks. Yes.
Right, and so then the language that refers to for when it has been deemed safe to return, that language would not be necessary with that amendment, correct?
Correct me if I'm wrong. The way I understood it was that the language around when deemed safe to return to in-person instruction is primarily focused on the priority groups, that they may enter into an in-person instruction.
Oh, is that the case?
That's what.
Yeah,
that's
right.
I think if I may, there's two important details in this in the amendment that Mr. Clinton has brought up. First, it addresses the timeline issue, but as Dr. Birdsong also alluded, what is safe for in-person instruction is a fluid item. It's a factor of many details. It's not just case prevalence, but it's mortality, it's illness, it's capacity of our hospitals, it's the equipment that we have. And so I would say having both of those options in there gives us some clarity for our stakeholders and our family members, but it also allows us to look at the safety issue, which is why we're having this conversation to begin with. But it also highlights the fact that we are giving that attention to those subgroups. So I think it's very well noted here, outlining what our concerns are and what our intention is and what the direction is for the administration.
Ms. Vacine, thank you, Dr. Gabriel.
I was just going to say, rather than saying that, just say for when the health environment has improved. Because, I guess where I get stuck is that we're technically, again, in the phase that we are in, we are able to bring in some in-person learning. So we want to be clear that we are not sending mixed messages, I think, because what worries me is that we might get too far away from planning for in-person learning if we're not intentional about it. And so I agree. I've been profusely reviewing all of the health data and looking at it. But when I think about the next 7 weeks and what this community as a city, what we may be able to do in terms of reducing the spread of this virus, I'm somewhat optimistic about getting to a point where we could consider bringing in groups of students. And so I don't know if I'm changing it. I agree with the parameter, but I think we could, to be clear to our public, what is deemed safe is a reduction or an improvement in the health environment for our families.
Mm-hmm. Absolutely. But again, I think because there's so many unknowns moving forward, as was discussed earlier about this virus, changing circumstances, I really think that leaving the language as it is just in case something we don't know about enters into the discussion, I think that I agree with the language as is. Ms. Campson, and then
Real
Mr.
quick, I can see what Ms. Bassine was saying, and she's right. We need to be tracking it, but I think that the superintendent and her team has been very clear that they will be doing ongoing planning. I know when I first asked Dr. Pohl about this after the presentation last week about the priority groups and was he going to be doing something about it, he was very clear when he said they were already planning. So I think that we should assume that Dr. Birdsong and her team will be planning as they go, constantly shifting based on what's happening with the safety and this virus as it spreads. So I like it the way it is, obviously, but because I think it's more specific than health conditions. Thank you for letting me just add that.
Yes. Dr. Birdsong, can you respond, please?
Yeah, just 2 points of clarity. Number one, certainly, we will continue planning no matter what. That's what we do. We're going to be planning. We're planning today. We're going to be planning tomorrow. We're going to be planning throughout the summer break and throughout the year. We're going to be very intentional about planning. We're going to be looking at our local health data. Yes, we are in phase 3. We are in phase 3 right now. However, we need to be mindful of our local data. The governor was very clear and specific about that. Although, we are in phase 3 and we may be at a 16.7 or 15% rate of positive testing, another locality may be very low. So please don't get us being with us being in phase 3, don't confuse that with our local data. So I just wanted to be clear with that.
Modified phase 3, because the government modified that.
Oh yeah.
Mr. Jordan, please go ahead.
Yeah, I think I'm just getting more and more confused. So under the current motion and the presentation, are we saying that when school opens in September, that there will be some in-person instruction that's being provided to equity and opportunity students? See,
No.
Dr. Gates shaking her head. That's what I'm trying to make sure.
No, it is 100% online learning. No child, no staff member will be delivering instruction, only to be coming in, getting equipment, whatever it is that Dr. Birdsong has shared. But it is very clear, no large group gathering of any kind, all virtual instruction.
At least for the first 9 weeks, and then
Yes.
we reassess it.
Dr. Birdsong, so I guess I'd like to rephrase that question and say, if deemed safe to return to in-person instruction, would the equity and opportunity students that have been identified, would we have the capacity and environment, provide a safe environment for them to have in-person instruction on September 8th?
As I stated before, I can't predict what September 8th is going to look like in terms of our rate, our testing positive rate. I can't predict what the conditions will be, but what I have said is that our team will be prepared the best that we can with the information we have to educate our children.
Thank you.
And this is our decision, y'all. The board has to give direction to the superintendent. We're not like any other division right now. Chesapeake is having the conversation, Virginia Beach, Portsmouth, Suffolk. So whatever we say they're going to do, we just have to tell them what we want and they're going to do it. And we have to be able to live with that decision and move on, because our job is to educate kids. It's not necessarily to open up schools, it's to educate children. And we have to do that in a safe way. So I would just say to my colleagues today, please let us leave with a clear direction for our superintendent. Whatever that is, I will support the will of the board, but we have got to leave giving them a clear direction.
Yes.
Right. It's time to make a leadership, just be a leader and make a decision. That's why we're here, to make the tough decisions.
We are here to make a decision, but I'd also like to give everyone an opportunity to have their questions answered. And so Ms. Basine, go ahead, and then we'll move forward with making the decision.
Okay, well, respectfully, I'll defer to Mr. Jordan because I know he had his hand up, I think, before I did.
I'm sorry, I missed that.
I just want to say again, I agree 100% with what Dr. Gabriel said. What I'm trying to get clarity on, because of the language, I just wanted to get clear because I still feel like I'm hearing different things. So all I was trying to encourage the board to consider that we be prepared to offer to some students, as defined by the administration, in-person instruction to support some students. The health data is always going to determine whether or not it can be done or not. So I get that piece. But right now, where we are today, and I have no idea where we're going to be tomorrow, but as I understand where we are today, we would have the ability to do some of that. So I'm just trying to, I sent you all a note around my talking points. I was just simply trying to say to kind of codify it so that students would know, parents would know, and the board would know whether or not we would be providing some limited in-person instruction to a cohort of students based upon the criteria that we've talked about. I think Dr. Gabriel just said the answer to that is no. And if that's the case, then I'm clear on what I'm voting on. If on the other hand, I've also heard that, yes, we're going to do all virtual, but yeah, we're also going to be doing some in person, then I'm not clear. I just want to be clear so I can vote in support of whatever direction we're going to give to the administration.
It's the maker of the
Right now, we're voting on the amendment. So the amendment is the adding the language of the first quarter 9 weeks, which Dr. Birdsong had responded to. So I'd like to go ahead and just vote on the amendment at this time. Ms. Tanner, can you please call the roll, call the question?
Yes, Basine?
Aye.
Campson?
Aye.
Blanton?
Aye.
Jordan?
Nay.
Martin?
Aye.
Smith?
Aye.
Gabriel?
Aye.
Okay, so go ahead. I'm yielding.
Jordan.
I'm having some glitches here. I don't know if anyone else is experiencing that.
No, I was just going back to the original statement that I made some time back to Mr. Jordan when he brought this up about the in-classroom instruction, that I felt as though that would be a separate motion to further clarify and not a part of this. So once we clean this up here, I would be more than happy to support looking at and giving direction to the administration to have a plan in place so that when things, if they do change, that we have some different options. And I think they've already started to do that with some of the options they've given us already. But Madam Chair, we're now voting, well, the item now is the motion as amended.
Right. So, so Ms. Tanner, can you read the motion as amended, please?
Says I move that the board directs the superintendent and administration to plan for 100% virtual learning to begin the 2020-2021 school year in parentheses.
No. To begin first quarter, 9 weeks.
Okay,
of the
I can fix that.
2021.
Okay, let me start 100% virtual learning to begin first quarter 9 weeks of the 2020-2021 school year to give added consideration to the academic priority groups, K3, special ed, ELL, throughout the virtual learning process, and for when it has been deemed safe to return to in-person instruction.
Thank you. Can I have a motion to adopt the,
No. Just call the,
sorry.
just call the roll.
Can we get a second? Where are we?
Yeah, I didn't hear a second. Did I?
No.
Second.
Clear. This has already been moved and seconded. It's just been tabled to this meeting. We just had an amendment to the motion. And so now this motion is live discussion if there's any additional, and then we proceed to vote.
Okay, sorry. Go ahead.
That's okay.
So any discussion on the amended motion?
No.
Okay. We'll call the question, Ms. Tanner.
Basine,
Aye.
Campson,
Aye.
Blanton,
Aye.
Jordan,
Nay.
Martin,
Aye.
Smith,
Aye.
Gabriel.
Aye.
Thank you. Dr. Birdsong, you and your team have, I know you guys are going to do a wonderful job for our students and for our community. And I appreciate all that you've done so far. And so moving forward, we have our next meeting on August 12th. And so I look forward to hearing more details about how all of this will be rolled out. And hopefully, well, I'll pray that we have better health conditions come August 8th so we can start, considering a farther forward. Ms. Basine, did you have something?
Yeah, could you share with the board a little more about what is being planned for August 12th? And if this is an opportunity to share some thoughts about what we as a board can expect, or if we can discuss what we can expect and when we can expect it. I'd like to have some.
So
How about
I don't
you-
want to call a
This
point
was a
of
call
order,
meeting.
but it's a special call meeting, and so it's got to be germane to the items that we're talking about today. So
Feel
this
free to
impression-
email me any
Yeah.
questions or suggestions that you have about our August 12th meeting, and we'll handle that offline. Okay. All right. Well, thank you so much. Everyone be safe. And I will call this meeting as adjourned.